Let us discuss nursing considerations for cardiac glycosides and antihyperlipidemics. With the cardiac glycosides, that's going to include the digoxin, and antihyperlipidemics is those statins and PCSK9 inhibitors. With digoxin, it's a pregnancy category C. Obtain a thorough medical history. Has the patient had any digitalis preparations in the last 2 weeks? It's a high alert medication, so have a second practitioner independently check the orders and dose calculations. Assess the apical pulse for 1 full minute prior to administration. Withhold and notify if an adult's heart rate is less than 60 beats per minute. Assess the IV site. There is a risk of redness, infiltration, extravasation. Monitor the blood pressure periodically. Monitor the ECG during an IV administration 6 hours after each dose. Notify if patient develops bradycardia or if new arrhythmias arise. Monitor that INO. Obtain daily weights. Assess for edema. Assess lungs for rales and crackles. Lab considerations. We need to check for hypokalemia, hypomagnesemia, hypercalcemia, and drug toxicity. With hypokalemia, if the renal function is good and if there is no heart block, we can administer potassium salts. Correct any additional electrolyte imbalances. There is a narrow therapeutic range of 0.5 to 2 nanograms per milliliter, and you can draw these labs as early as 6 to 8 hours after the dose or as late as immediately before the next dose. You need to observe for signs and symptoms of toxicity. With adults or older children, that's going to be the abdominal pain, nausea, vomiting, anorexia, bradycardia, or other arrhythmias, as well as visual disturbances. With infants or small children, that's going to be cardiac arrhythmias. With the signs or symptoms of toxicity, withhold the drug, notify the provider. Digitalis toxicity arrhythmias, we can treat this with lidocaine, phenytoin, propranolol, quinidine, procainamide. If they're life-threatening arrhythmias, we may include digoxin immune fab or digibind. That's essentially going to be our antidote for digoxin. Medication adherence is crucial. Do not discontinue without talking with your provider. Discuss all over-the-counter medications and supplements and herbal drugs before taking this drug. Teach the patient how to check their pulse prior to taking the medication, and notify your provider if your pulse is less than 60 beats per minute. Do not be consuming any antacids or antidiarrheals within 2 hours, and high fiber meals need to be consumed at least 1 hour before or 2 hours after taking digoxin. Geriatrics will have an increased risk of falls, so we need to implement safety precautions. With antihyperlipidemics, again, that's going to be the statins and PCSK9 inhibitors. Essentially, we're treating the hypercholesterolemia because that can lead to atherosclerosis, and that's essentially a plaque buildup in the heart's arteries and vessels. Our goal, again, decreasing the hypercholesterolemia with diet and medications such as the statins. Oral drugs, those need to be taken daily. Again, those are going to be the statins, the atorvastatin, simvastatin, pravastatin. With the injectable drugs, those are going to be monthly, the PCSK9 inhibitors, Repatha, Praluent. With antihyperlipidemics, you need to take these at the same time every day. Take it in the evening, and that's just because it's easier for the body to metabolize cholesterol at night, and most cholesterol is synthesized amidst low dietary intake. Also, it's just going to reduce the risk of those side effects such as the dizziness, nausea, weakness, myalgias, poor concentration. There is an exception. With atorvastatin or Lipitor, you can take that medication anytime. You need to obtain a thorough medical history, and that's just because of those risks of contraindications such as the liver disorder. Since antihyperlipidemics may cause liver disorder, we need to know if they already have this. Also, it is a pregnancy category X drug. Assess for GI upset. Obtain vitals prior to administration. With laboratory considerations, we are going to be watching the lipid profile, CK, AST, ALT. Obtain baseline and monitor throughout therapy every 6 to 8 weeks for the first 6 months of therapy, and every 3 to 6 months thereafter. And patients need to be fasting about 12 to 14 hours prior to serum chemistry panel. And just from experience, make sure your patients know that fasting means they can continue to take their regularly scheduled medications and water. We need to be reporting any myalgia. Advise the patient to drink plenty of water when taking these medications.